Hello friends, my name is Dr. Tarpan Shah. Today I will discuss chest physiotherapy techniques in infants and children with you all. Okay, now most of the techniques what we used for the treatment as a chest physiotherapist in infant and children are the same techniques like the adult. The basic difference is in adult we do more of a we ask the patient to do, like we go with the more of an active approach. In infants most of the techniques we do it that is passively, and in children some we have to do some treatment even they will be able to do. So that is a basic difference in the adult and the infant and children. Contraindication for the approaches are almost same, and generally we try to avoid giving the treatment in the infants and children because it has been proven that the treatment what we do it may have a detrimental effect if we are not doing it in a proper way. So, okay, so these points we have to remember. Now always the golden point is we need to do the treatment for the infant and children before the feed. Okay, if we do after the feeding, there is a chances that some food particles, a bolus of food particles may go to the respiratory tract rather than going into the digestive tract. Okay, what will happen? Some particles may go into the respiratory tract where that agent may act like a foreign body and it may cause some infection that is called pneumonia, and we can classify it as a aspirational pneumonia. So better is to complete the treatment before the feed. But if not possible, okay, so what you can do is it requires to do that after feeding you have to give treatment, keep a gap of at least 30 to 45 minutes to avoid the vomiting and the aspiration. Now the first technique is your chest percussion, also known as the chest clapping. It can be done by using the hands, fingers or the face marks. So you can do it with your hand, you can do it with your just 2 or 3 fingers, or even you can make use of the face marks which is available in the ICU. Percussion with the one hand used in the small children and the babies. Okay, mother can take the patient in baby in the mother's lap, and then you can teach the mother how to do it, or even you can do it in the mother's lap. Okay, so with the one hand we have to do, as the diameter of the chest will be less. Neonates and infants, we can use a technique called infant, where in tenting, what we do in the tenting is we keep our index and ring finger near to each other, and above to that we keep our middle finger. So middle finger will go for the slight flexion, and then we'll do the tenting procedure. Okay, we do the percussion things on the patient's chest. Okay, especially in the neonates. Second technique is vibration and shaking. Vibration should ideally applied at the beginning of the expiration, followed by the oscillatory obligations. And precautions with the vibration and percussion technique we have to follow as we are following in the adults. Okay, only you have to remember is vibration and shaking. We do it in the expiratory phase of the respiration, whereas percussion you can do it irrespective of any phase of respiration. Postural drainage, we prefer to give head down tip position to the infants and babies, and modified postural drainage in that we can teach the mother how to keep the baby in the lap, and gravity will help in the mobilization of the secretion. Okay. Positioning, supine is least beneficial to the infants and children. Okay, prone will improve the respiratory function to a certain extent and decrease the gastroesophageal reflex and reduce the energy expenditure. Only thing you need to see that you give any position, the breathing should not be interrupted. Okay, so avoid giving the supine position. Okay, maybe go for a sideline or a prone position. Okay. Manual ventilation. Okay, that you can give it with the manual ambulatory manual rebreathing unit, ambo bag, what we call it as a popularly. So for infant you have to use 500 ml of bag, and for children you have to use 1 liter of bag. And two terms here you have to remember. First one is your hyperinflation, and second one is your hyperoxygenation. Oxygenation means what? Just suppose you are disconnecting the patient from the ventilator for doing a suctioning, for example. So before disconnecting the patient, you can go for the hyperoxygenation. You can increase the amount of oxygen which you are delivering. So what will happen when you are disconnecting the patient and doing the suctioning and again connecting the patient, the deficit of the oxygen will be, little compensated. So you can go for the hyperoxygenation. Inflation is aimed to recruit the young lung units by improving the collateral ventilation and increasing the lung volumes. So collateral ventilation channels are like reserved ventilatory channels present in the lung. Okay, there are three in number. That is pores of Horn, channels of Martin, and channels of Lambert. So when we do go for the hyperinflation, we can recruit these units. Okay, and we can increase the lung volumes. Lung volumes are four in number. That is your tidal volume, inspiratory reserve volume, expiratory reserve volume, and the residual volume. And there are certain independently performed airway clearance technique, that is ACBT, active cycle of breathing technique, AD, autogenic drainage, high frequency chest wall oscillation, oscillatory positive expiratory pressure. It includes three devices: flutter, acapella, and cornet. Okay, breathing exercise, cupping, airway suction, passive movements, and the other PNF and the other techniques. The PNF cannot be performed independently. Okay, so there are other techniques that can also be used in the patients. Okay, so remember that treating the adult and the pediatric and infants are totally different. You need to be aware about the anatomical and physiological differences, and your techniques will be also modified, slightly new technique, or with the modification you have to give the treatment. And it's not easy to treat the infants and children. That is what I have learned over a period of time. Okay, and I still remember the incidents when I have asked to do the suctioning for a 1 or 2 days old baby who was operated for a cardiac surgery. I was not even able to do a simple suctioning procedure. Okay, so always, whenever it is possible, first we need to learn. Okay, and then we need to try and apply our treatment in the patients. Okay, thank you very much.